Hello, everyone, and welcome to the Savvy Cast. This is Jamie, and I'm so grateful that you are tuning in today. This episode will be a Q&A on the topic of plastic surgery. My guests today will be Dr. Michael Clinton and Dr. Ben Pierce of Reveal Beauty. They have decades of experience as plastic surgeons, and they are so graciously appearing to answer questions submitted on the Family Savvy Instagram as well as the Reveal Beauty Instagram. There were many questions, and the doctors have wonderful answers. I was honored to speak with them earlier today, and I think that you will find this episode extremely informative and beneficial. So, without further ado, let's welcome Drs. Clinton and Pierce. Dr. Clinton and Dr. Pierce, thank you for being on the Savvy Cast today.
Well, thank you for having us. It's good to be here.
I am so grateful that y'all are taking time to join me because you so graciously allowed me to ask my Instagram followers if they had any questions regarding any aspect of plastic surgery. And we have a ton of questions. There are so many things that people are concerned about or that they would like to know about with plastic surgery. So thank you for being here. Before we start, could y'all just briefly introduce yourselves to the audience?
Sure. I'm Dr. Ben Pierce, and I am Dr. Clinton's new associate. I have joined him at Reveal Beauty. And I am originally from New Orleans, but I moved to Birmingham as a kid, and I decided that this is where I wanted to come back and practice when I finished. And
Dr. Pierce, for those of you who follow the Savvy Cast, has been on a previous episode where he talked about breast health, and it's a very popular podcast. So those of you interested in all aspects of breast health and the different surgical options there, that is a must listen because that is exclusively about the breast procedures, whereas today we'll cover the gamut. So right. Dr. Clinton.
Yeah, Michael Clinton, and I've been in practice, private practice, about 30 years. Grew up in Huntsville with a space program with parents that were involved in the space race, so to speak, and was the only person in my family that wanted to be a doctor. And after a while, it became kind of expected that I was going to be this. But I did not go into medicine to do plastic surgery. I went into medicine to do more of a general practice and maybe general surgery. And I learned at some point in time that I enjoyed putting things back together better than I enjoyed taking them apart. And so that's what I've been doing for the last 30 years of private practice. And like Ben, we train, 7, 8, 9 years after medical school to kind of get to this point. I'm delighted to have Dr. Pierce with me. First time I've really had a partner in the practice. It's created an environment that I have welcomed, and that is one in which we can exchange ideas. We can run problematic patients between the two of us. We can just on the spot exchange information and opinions, and it's been good for patients. It's been good for me.
I will say both of you have just an excellent bedside manner, so I want to commend you for that.
You're very kind to say that. It's very important to us that people feel that way. We don't want you to be the only patient that we have, but we want you to feel like you are. Mm-hmm. And I think there's a fine line between those two things. And I know Dr. Pierce shares the same philosophy. There are technical aspects of this thing that so many of us have been trained to do. We don't all get the experience that Dr. Pierce and I have had doing these things, which is a great place for patients to start. But the other parts of this, and that is trying to crawl in your head and see what you see, listen to where you've been, listen to what it is that you're focusing on, is something that we both share, and we think it requires time. It requires more than just a few minutes to get that done.
So we're just going to dive in if that's okay with y'all.
We're ready. Come on.
Okay. One of the first things is one that was repeated several times, blepharoplasty. And I've had several questions about this. puffy eyelids, bags underneath. When should I do it? Will it help? What do you say about blepharoplasty?
I think that's a great question. And I like that you brought age into it and when.
Mhm.
For anyone that's bothered by the appearance of their, we call it the periorbita, and that's the tissue around the orbit. You know, if you're bothered by it now, in my opinion, that's the time to do it. There's no reason to wait on this until a later date because it'll make the result better or you'll get more longevity out of it. If it bothers you now, then now is the time. In terms of what options do I have, what surgery do I need to entertain, that's a patient by patient basis. Oftentimes it's a little bit of extra tissue to the upper lid. With the lower lid, oftentimes we're seeing people that are concerned about this bagginess, and what that is an excess of fat in certain areas under the eye where it's protruding out. One of the things that I think is super important when we're talking about periorbital rejuvenation is the use of one's own fat to replace some of the volume. We start losing volume in our under eye area as early as our 30s, if not late 20s. I find that that's one of the first areas of our face where we start to age.
The hollow-eyed look.
Exactly. And so there's different ways to remedy that. One is the use of fillers. And I feel like the general public is very much informed about these fillers. But another thing that I like to add is the use of your own fat. And so via liposuction, where we remove fat from one part of the body, we can then place it into this area underneath the eye where that fat volume has gone away or disappeared or started to drop a little bit. And that is another solution a lot of people don't think about when they're thinking about that eyelid rejuvenation, is actually transferring fat back to an area that we've lost it.
Dr. Pierce, is every person going to need something, if whether the fat was excessive or just minimal? Will everyone need something to go in to avoid the hollow look, or do some people just come out perfectly without anything added?
I would say that there are some people that are blessed with the lack of looking like hollowed look, but most people, as we age, again, that's their first place to hollow. So I feel like that is a good solution, is at least some volume restoration in that area, but not everyone.
That's true. It's as much about genetics as it is about age. I've seen 30-year-olds that had all the eye changes, and I've seen some 75, 80-year-olds that really didn't have hardly any eye changes, which is very unusual. But what you use to revolumize the midface, which the lower eyelids are part of that, we've got several options. Dr. Pierce likes fat. I like some other things. And I think it has some of its training, some of its experience, some of its age and exposure and things like this. But I don't replace that as often as he does. And that tells you there's more than one way to get things right, because we both feel like we're doing it right. But lots of options, and you need to see somebody when you're talking about these options that provides several, where you can make an assessment of what's going to be best for you and let the surgeon help you with that decision.
If you do the fat, that is a more permanent. Filler is just with an injectable. So that's just easier to control, correct?
Right. Jamie, you've picked the topic that we're different on, and it illustrates that you have options. And for some people, using fat there, which you say is permanent, is a good thing. For me,
right, that's right.
I'm sure I want something really that permanent there. That's kind of my line of reasoning. And some of the longer lasting HA fillers, possibly, or even platelet rich plasma. But we're in a real exciting time as far as facial rejuvenation, and fat grafting is one of the most exciting things that we're doing.
Well, before we leave the topic of bleph, I will say I have several friends who have had this, and the difference is so dramatic. Would you say this is one of the biggest bangs for the buck procedures?
Number one. Well, when people come in, and you may have seen this, and they come in and they get a little bit of a menu list of things that they're looking at, and we've suggested that they could benefit from. And then they ask you the question, what's the one thing I should do? What is the biggest bang for my buck and the greatest effect and the greatest value from my money? And I just basically say, this is what we're looking at each other through. We're looking at each
Right.
other through these glasses, and we're seeing each other's eyes most of the time. So if you're going to spend any money on anything, do your eyes.
That is great information. And isn't it one of the easiest to do? Is outpatient, correct?
Easy is an interesting word.
Yeah.
I would say in terms of the patient tolerating the recovery,
Mhm.
yes, you're
Okay.
right. It's an outpatient procedure.
Mhm.
You have to deal with a little bit of swelling, sometimes bruising in the under eye area, which all seems to be rather tolerable from a patient
Right.
perspective.
If it were easy, they would do it at Walmart.
Right. And I did mean from a patient's perspective because it's easier in that regard and recovery.
Jamie, I would tell you, years ago, I had an upper eyelid bleph and I operated the next day. So the recovery can be very, very
Wow.
quick.
Now, is there something that you would recommend for someone who says, I'm going to get a bleph, that's the biggest bang for the buck? While you're working on them doing that, is there something for those who want to just throw in a few extras while you're on the table that
We're,
might?
we're both whispering back and forth. We know exactly what that item is. And
So for us, it's frequently a skin resurfacing procedure with the use of a CO2 laser. That results in the reduction of fine wrinkles throughout the entirety of the face if the entirety of the face is treated, but then just offers this rejuvenating capability to the skin that this laser provides that a lot of other lasers or topicals just can't do. And that's a great time to do it. It doesn't add that much length to the procedure.
Mhm.
And in terms of recovery from a tenderness or painful standpoint, it doesn't really add any. You do have to go through the woes of some skin changes that occur over the course of 7 to 14 days. So
Mhm.
if you can tolerate that, you can take some time for yourself to be maybe a little bit more private, so to speak,
Mhm.
maybe more reclusive, then it will pay off in dividends. That's not just, it looks good for a month, it looks good for years down the road.
Okay, now the CO2, because there are so many different names for so many different lasers. Do you call this something or do you just call it CO2? Is there another term for it?
Well, CO2 is a class of lasers, carbon dioxide, CO2. That's just more of a class of lasers that are all considered to be ablative lasers. So when they hit their target, which is the water in your skin, it creates a little micro ablation, a little micro spot. And you can see the little dot on your skin because this is a fractionated technique. But you bring up a good point. When people start talking about resurfacing lasers like this, they're not created equal. And even if we all had the same laser, we could use it an infinite number of different ways.
Mm-hmm.
So you have to be very careful. We have within our office, we have a low power laser, and we have a high power laser.
Mm-hmm.
And for ladies that want to make maybe like 3 days of recovery, then the lower power laser is the one for them. But the ones who want the greatest results, one that heals in about 6 or 7 days, looks like a wind burn at that point, is ready to go whenever the stitches come out on the eyelids. The more powerful laser, it has a name. It's CO2RE. So we call it the core laser. And the other one we call the echo laser, which is a less powerful one. So good point. Hard to compare apples to apples unless you really know. And when someone asks us, we know pretty much every laser that's being used in town. So we kind of can tell them what they're considering.
Well, let me ask you, for those who may not need a bleph, but they are worried about that maybe their skin is crepey, has fine lines, and they would like to have the biggest bang for the buck and get a core. Can they tolerate that without being put to sleep?
Yes,
Okay.
there's several options. I can tell you right now, when you do my core treatment, I'm going to take some IV sedation and just cruise right through it and have a good time.
Yes,
Okay.
yes.
But if you have something where you just have an issue with the idea of IV sedation or being kind of put to sleep, you can take oral sedation, you can do a topical, and we can also do some local injections. So we have several options to suit the patient. Not one kind of anesthetic is good for all patients.
You say if you want the best laser, the biggest result, do the core. That will address what?
I tell patients almost every day that a core, which is the more powerful fractionated laser, will remove most of their fine lines, and it will soften the very deep lines. And some of the deep lines will go, but every fine line basically will go, and the deep lines will be softened. All uneven pigmentation, which we call dyschromia, photo damage, sun damage, all of the uneven pigmentation will go. It will absolutely tighten your jawline. Now, will it make you look like you had a facelift? No, but that jowling will look better. It will look better because it will tighten your jawline. Those little fractionated laser dots are not just stopping at the surface. They're going down into the skin. So they're driving little pylons of energy down into the dermis. And as it heals, it creates collagen and elastin. So it will tighten your skin. It will make it thicker and fluffier and healthy looking, more radiant. And, you start to see that effect at about a week. At about a month. You see the initial effect, which is a smoothing, incredible smoothing at a week. But at a month, you start to see that collagen effect. And it gets better and better for almost a year, and then it plateaus. I got people we did 20 years ago that say it's the single best thing I've ever done.
I have to ask you this because I did my first Infini
Yes.
Friday. And are those mutually exclusive? Or because Infini, I know you recommend stacking those.
Right.
But if someone wanted to just do the core, would you say don't do the Infini?
And I don't want to dominate the conversation. He knows as much about this as I do, but that is a very, very common, very good question. They are both fractionated energy forms, meaning they've been broken up into little dots. But one is a laser, which is the core. One is not a laser, it's an energy source, which is the Infini. If you have lots of surface changes on your face, uneven pigmentation, fine lines, keratoses, rough spots, the core is what you should use because it is all about surface changes. You are going to get some deeper dermal tightening with it. But if you're talking about your neck now, and it's got crepey and it's fine lines, and it's just not looking it's looking old, to be honest. What you want for that is something like the Infini, because it doesn't care what the color of your skin is. It doesn't care how old you are, anything. It's going to drive energy because of these little pins, these little microneedles down into your dermis and create a thickness and a tightness. So what a lot of people end up doing is they treat their face with the core and their neck with the Infini, okay? And then they come back because the Infini is a serial treatment, meaning you get several sessions. And 6 weeks later, do another Infini, but this time don't do just your neck, do your whole face. And then another 6 weeks later, do another Infini. The core is a one-time treatment, that laser. Very, very common that you get just one treatment for the core, and that's really all that you need.
So if you want to do a core, and you're going to do Infini, how do you do the timing?
Infini for the neck initially, because you're doing the core on your face and you can't do them both on the same tissue at the same time.
Right.
But it's the core that you need for your face on that initial treatment. Go ahead.
I was going to say, but you could divide.
And that's what I suggested.
You could do the CO2 to your face while at the same time having the Infini procedure to your neck. So you're down, you're getting your IV sedation or what have you, so you're comfortable, and you could get it all done in one with the need for the Infini with a couple extra cycles, because that's just how you get the best benefit out of that.
I did the Infini on my face and my neck, and I can already tell that it's not tightening. And I did it with just Pronox, and I found it very tolerable. And I went to the highest. So,
well, see, but Jamie, you elected not to do the core on your face because of the downtime and that kind of a thing. And so you did Infini for your whole face,
right?
Which is fine. That's a great option to do that. And you can see it's an overnight recovery, normal skin care the next day type of a thing.
At what point would you all say, well, the Infini can do a little bit, but there's probably more for a lot of loose skin on the neck?
That answer is not going to be the same for everybody. And it really requires us taking a look and testing kind of what your elasticity is to your neck.
Mm-hmm.
It doesn't take a lot of neck laxity to get to a point where facelifting is going to be the best thing, and anything other than that, it's not going to be a good use of your resources.
What is involved in a neck lift?
So a neck lift, in many ways, is synonymous with a facelift.
Mm-hmm.
And what I mean by that is their incisions are very similar, if not in some cases exactly the same. But it involves an incision that goes around the ear, over the front of the ear, and then also behind the ear, and usually along the hairline for at least a few centimeters or so.
Mm-hmm.
And then this allows us to undermine or lift up some of the skin, allows us to redrape that skin and remove the excess skin, such as in someone that's got loose excess skin to their neck area. It also affords us the opportunity to address some other tissue structures and, in some essence, reset them. In access for the facelift, we have access to the musculature of the middle face and allows us to reset that or lift it, therefore pulling the jowling tissue that happens right around close to our chin, near the corner of our mouth, back up to the position where it used to be.
If one were going to get a neck lift, would it not make more sense to just go ahead and do the whole bottom of the face? Because I mean, I know personally my whole bottom, I mean, it's not just my neck.
It may surprise you, Jamie, but there can be some gimmickry in plastic surgery in general.
Mm-hmm.
And there are guys who kind of sell people on the idea, we're just going to do a neck lift. But to Dr. Pierce's point, it's all about balancing the needs of your face. And if you're going to lift your neck, you'll probably end up getting into the mid face at least, if not even higher. So it's a balancing act. Some people need more concentration on their neck. Some people need more concentration on their brow. But it is a facelift with concentration, for example, on the neck, if that's what somebody wanted. Not just a neck lift. You can't just stop here. It has to feather into the remainder of your face.
Mm-hmm. Would you recommend for someone, say, who feels like maybe they're a little young for a facelift, would you advise them to wait, possibly do some of the Infini treatments, or would you tell them to go ahead, and would they have to repeat that in a decade or so? It's because they don't last forever, correct?
You know, this probably is a question that I get more than Ben does because of my age, and the population I see for facelifting is probably in their early to mid 50s, although we're seeing a lot of people in their mid to late 60s and early 70s that wanting facelifts and stuff. But if you get a facelift when you're 30, you probably ought to expect that when you're 60 or so that you may age enough that you want to do something else. If the first time you're getting a facelift is in your 50s, which is kind of average, that's probably going to be your only facelift that you'll ever really want. Our patients, or certainly my patients, don't come running to me every time they see a little tiny wrinkle. That's just patient selection for me. Right. So I don't get a lot of people asking me for retuck-ups. A lot of plastic surgeons make a good living tucking up their own facelifts. I've done 2 of those in 30 years. Is it because I'm doing this great facelift? I hope it has something to do with it, but I think it has as much or more to do with patient selection. Our patients aren't running back when they're 70 and going, I just can't stand that one little line that's on my face. Some of the celebrities that we see that are really advanced age, and they have these just perfectly porcelain smooth faces. Their plastic surgery was great, but it's a little bit creepy, the fact that they're 80 years old and they don't have a single line on their face. That's not the patients that we're seeing, or I'm seeing for sure at this point. But I would expect that for most of our patients, that facelift is going to be the one that they need and enjoy for the rest of their lives.
What would you say to someone who said, I want a facelift because I want to deal with the neck and the sagginess, but I want to look like myself?
For us, that's a no-brainer. That's just our ethos for how we conduct ourselves with what it is that we do. And we never want anyone to walk out of here, or for when they get to their final recovery, to say, I don't look like myself. Our goal is to do everything and be mindful of where someone started and what their goals are. So for either of us, I don't think that's ever been the case for someone to say, I don't look like myself. We just want to rejuvenate you, maybe turn back the clock. We want you to go see your friends, see your relatives, see your coworkers, and they all just say, wow, it looks like you took a week-long vacation and you slept 20 hours a day. That's what we want to hear in regards to your outcome.
The greatest compliment that he and I can get is that lady that comes back at 2 weeks after full face lift, eyelids, core laser for her skin. She is 2 weeks post-op, and we hear this frequently. And she comes in and she said, I just had lunch with my girlfriend. And you know what they said? They said, I don't know what you did, but I like it. That's all we want to hear. Case closed.
That is very important to some. Some want to have more of a visible facelift appearance.
Well, Jamie, some people want to brag about their plastic surgery and compare. My patients don't want to do that at all. And we know those things that make someone look like they've had plastic surgery, and we avoid that. We want it to be a very conservative, doesn't look like I had one plastic facelift.
Well, let me move to mommy makeover. Okay, I don't know if that's what you call it, but it's typically the breast and the tummy.
And maybe some lipo just to kind of help shape some other areas. Yes.
When you do a tummy tuck, do you sew the muscles back together? And is that just on women who've had a C-section, or is that everyone who gets a tummy?
It doesn't have to do with the C-section. It's actually going through pregnancy. It's carrying a child that puts stress upon the abdominal wall. It's the hormones that are going through your body that tell your abdominal wall to relax. It's the act of those things which results in that widening or that space in between your muscles. It's not actually the C-section itself.
Most of the time, Jamie, when they do a C-section, they make a transverse scar, but when they get down to these muscles that go up and down like this, they go right down the midline. So if it's repaired, then theoretically it shouldn't be the cause. But if you stretch that so many times, you'll get a gap, and your tummy will just look fuller than you want it to.
So when you do a tummy tuck, are you sewing those two muscles together?
If someone needs it.
Right. Okay. And then what else is involved? Is it lipo in some cases, all cases? What's the typical tummy tuck like?
The typical one is repair of the muscles if needed. But then oftentimes it's a removal of redundant or excess skin that has lost elasticity because of the weight gain, the change in shape associated with pregnancy. You'll see this very loose, almost crepey-like skin we were talking about in the neck, but in the lower abdomen. And so it's a removal of that. And then plus or minus, like Dr. Clinton was saying, liposuction to other areas just to improve overall contour.
If you are getting a tummy tuck and you're doing a little lipo, do you do lipo? Do you go any lower, like into any of the thighs, or is that just a totally separate surgery?
Well, there's some areas of lipo that we use to feather the appearance of your tummy tuck into your body. And we usually include that as a part of your tummy tuck. But if you get down into areas of thighs and upper and lower back and arms and things, those are separate charges, separate operations that are done usually at the same time that we do the tummy tuck.
Okay. And the recovery for a tummy tuck is more involved, correct? And do you all do the drain? I know I've heard of Drainless. That's being talked about, Drainless tummy tucks. But is that something that you want, or is that something you need to avoid?
Drains have a purpose. There's only one reason to use a drain, and that's because you don't want fluid to accumulate. Can you do it drainlessly? You can kind of spin the chamber into like Russian roulette and just see if they're not going to get a seroma or a collection of fluid. Or you can use a drain that you get out in 2-3 days, maybe even a week, and they can shower even with the drain. The fear of a drain, the whole concept of a drain has been so overblown in the market. Most of the time I'm taking a drain out, talking to my patient, she doesn't even know I've taken it out already. So it serves a purpose. That's the only reason why we would use a drain. But you're lifting the quilt off the bed to get the wrinkles out of the quilt. So you create a space between the quilt and the sheets, so to speak. That's where the fluid might accumulate. So in a full tummy tuck, we drain them most often.
How long do you wear compression garments? post tummy tuck?
That varies for every patient. I typically recommend at least 2 weeks, but I find that people are continuing to wear it at least up until a month. And the nice thing about compression is that it's easily concealed. This is something you can wear underneath your clothes, your friends, your family, your coworkers. No one is going to be aware that you have compression on. And all of that is doing is basically speeding up your recovery to where you get to that point where the area that was operated upon feels just like the rest of your body. That's the goal of compression.
So it's really like wearing a Spanx, correct? Just
Exactly.
a little bit.
Yeah, usually about a week or so into it, we'll often let them trade their industrial compression garment for a Spanx garment.
Oh, wow.
If we think it's going to suit them.
Right. Okay, well, since we're talking about Mommy Makeover, we've talked about the tummy tuck. What are the breast options? What are all the options for, because every woman is, of course, different.
Well, I'll tell you the options, and I'll let Dr. Pierce maybe explain some of them, because you just started out. You could make them bigger, you can make them smaller. You can lift them. Sometimes just adding a little bit of volume will lift them. But you need a very experienced, trained plastics, and plastic surgeons are trained to do a lot of things. I mean, at some point in time in our training, even some of us for our professional lives, we've done just about everything from head to toe. But you want to see someone who does plastic surgery of the breast for breast concerns, and someone who does it often and frequently, and they can tell you what your options are. That's what you want to see, and that's what I believe and hope and pray that people see here in our office. We see a lot of breast surgery, and there is not just one size fits all at all. You need the educated, trained, experienced eye of someone who has seen the before and the after and can predict that well. So that's where you start. But all of those options can be on the table for a patient.
And you did say reduction could be one of the options. We had several questions about reduction, and one was, when can you get that covered by insurance? Is there a metric for when it's covered?
Yes, there definitely is, and it can be combined with other procedures if that's what you're interested in.
And even non-cosmetically, it can be covered with a cosmetic procedure, i.e. you could have a cosmetic tummy tuck but have an insurance covered breast reduction.
Oh, okay. At
the same time.
So
how does someone know how, because you can't go by cup size, correct? It has to be weight.
Right. So every insurance company is different in what their requirements are. But for the most, it seems for the insurance companies that we're seeing around here, it typically is around 500 grams has to be removed from each breast to be covered. But that's not the only requirement. They want to see that someone has struggled with symptoms related to larger breast, such as bra strap grooving over their shoulder, upper back and neck pain, or even problems with rash or infections to their skin where their breast is lying on the skin of their chest, causing an issue with a moist environment under the breast. So usually you have to have all those requirements, or many of them. In addition to that, we have to make sure that a reduction is the appropriate surgery for you if your insurance company mandates that a certain amount is removed. Because we'll have some patients that come in and they have all of those symptoms, but then we look at their breasts and say, if I removed what your insurance company is saying we have to, it would be disfiguring, or it would be inappropriate for your frame. So that's where, having the experienced eye can come into play, and is important to say, this is the right procedure for you, and this is why.
And in those patients, we can offer them what we call a cosmetic or aesthetic breast reduction. Same kind of a procedure, but we're just not removing as much. That's not covered by insurance. When
you do a reduction that's aesthetic, is there a lollipop incision? Is that what you all?
You're talking about a mastopexy or a breast lift. Now, a breast reduction is the biggest lift that we do. So I'll have people ask me, okay, I'm here for a breast reduction, but can I get a lift too? Well, you get a lift. The biggest lift we do is a breast reduction.
Oh, it always has to happen. You can't get a reduction without a lift. Oh, so you're not paying for something separate.
That's right.
Oh,
That is right. And a lollipop incision for us, I think more applies to our breast lifting technique, although there are people who have done for years, if not for decades now, a vertical breast lift, which is everything is vertical. But that's probably what you're referring to.
on that note, if you do any type of breast surgery that involves the nipple, does that interfere with nipple sensation, nursing? I mean, what are you looking at possibly in that area?
For any surgery of the breast where an incision is made around the areola, there's always that possibility. And so we counsel all of our patients on that is just an inherent risk of this surgery, and that's different for everyone. It could be some desensitivity for just a little while that returns, but there are some cases where someone has a lack of sensation for months and months, if even not years. So it's always a possibility. The same thing with a reduction, with the lift that comes with that, and breastfeeding. It's always a possibility that there may be a change in breastfeeding. They may be able to breastfeed with one breast and not the other. And unfortunately, it's hard to predict that, but it's just important that people are aware of that. And we always make sure that people are aware of what's to come after surgery.
Well, would you all agree? I have heard this, and I've also talked with many women, many of whom are younger than I am. I'm 55. That is one of the most rewarding patients. Patients are more satisfied after that than almost anything. Is that what you find?
Yeah, breast reduction specifically may be the most satisfying thing that we participate in. And patients say, if I'd have known what this was going to be like, I'd have done this a long time ago. What keeps people from doing it sooner? It's the fear over, what's going to happen to nipple sensation and breastfeeding and the scarring and things like this. And, the scarring is usually such that you have to get really close and then go, gosh, I think she has a little scar right there. If we can get it to that point, the patients say, I'd have done this a whole lot sooner. And I know they're also concerned about their significant other and their perception of them after having some scars on their breast. But my comment to our patients, Jamie, is when they see how it's changed your life and how it's enhanced your self-confidence and your relationship with them in intimate ways, they'll just give you the thumbs up that this was a great thing to do. So don't fear that.
I know you all have patients. Would you be, because we are not even halfway through. We've had so many questions.
Well, these are questions that we deal with every day, Jamie, and we're more than willing to share those answers with you and your viewers.
The listeners who may not live in Birmingham, do you do virtual consultations?
We do. Yeah, we prefer a personal contact. That's the kind of practice we are. It's the kind of people we are. But we also understand some of the limitations, and we also understand that technology can help us, get connected.
I was going to say, we are not unfamiliar with operating on people that are from further away.
Oh, right. Yes.
We also have accommodations for those individuals so that they can have a safe recovery, that they're close by to us. And so that is a part of the full 360-degree package of surgery here that we offer people, is an opportunity to stay close by. And that's a part of their professional fee for us for when they come to see us.
Well, that's wonderful. Dr. Pierce, Dr. Clinton, thank you. Thank you so much. I look forward to having you back again. And thank you again. And you all have a fabulous, fabulous rest of your day.
Thank you, Jamie.
You too. Thank you.